Welcome back to our podcast. This is a separate segment from our original episodes. We're going to be talking about CDH today. CDH is congenital diaphragmatic hernia. It is pretty rare. Not many doctors in this country know about it, know what to do with it, know how to deal with babies who are born with it. So the month of April is Congenital Diaphragmatic Hernia Awareness Month. We are going to be talking about that today. My name is Briana. I have a daughter who passed away 13 hours after birth. She had severe left CDH as well as multiple other chromosomal abnormalities. And I'm from Fort Worth.
I'm Miranda. I am from Ohio. My daughter Goldie passed away 18 days old from CDH. And I do have an older son who's about to be 5, and his name is River.
My name is Briana Fulmer. I can go by Bree for this podcast so we don't confuse the two Brianas, if you like.
I love that.
I have 3 babies altogether. So we have Killian, who is 4. Reagan is our CDH baby, who passed away 30 days after birth. And then we have Felicity, who is going on 6 months old.
I'm Stephanie. My son Maverick was born with severe left-sided CDH, as well as a chromosome issue and some heart defects. But he's 21 months old and thriving. So that's awesome. And I'm from Montana.
Congenital diaphragmatic hernia is a birth defect that occurs when a baby's diaphragm fails to fully form early in development, allowing abdominal organs to enter the chest cavity and preventing lung growth. They may also have problems with other developing organs besides the lungs, such as the heart, the kidneys, the intestines, and the brain. CDH is considered one of the most common congenital anomalies, occurring in 1 in every 2,500 babies, which equals to 1,600 babies born each year with CDH in the United States alone. It is just as common as cystic fibrosis and spina bifida, but not many people know about it. While the survival rate has increased from 50 to 70%, the survival rate in babies with severe CDH is 15% to 25%. It's kind of interesting how, for it to be one of the most common congenital anomalies, not many doctors know how to support babies with that. What are your thoughts on that?
For me personally, being in Montana, no one here knows how to deal with CDH. I mean, by some stroke of weird luck, I'm going to call it, some gal actually did have a baby here in my same hometown just like 8 months ago. But that is the first time I've ever heard of that happening. And the doctors here were like, whoa, that's pretty crazy because it's just a small state. There's not many people here. So they instantly, when we got diagnosed, they were like, it comes in ranges of severity, but you cannot have that baby in Montana. So either way, you're relocating if you want to have him.
At what gestation did you find out, and what were the doctor's reactions to it?
I found out at my 20-week anatomy scan. The doctor, I was the 3rd case he has ever seen in his practice, and he's been practicing for a very long time. In the office, they've only had a total of 3, including myself. And he gave me a little bit of information on it, but he didn't even know himself too much, and sent me to the nearest hospital to get with the doctor there, ultimately, which they sent me to another doctor somewhere else. So I was bounced around until I got to where I needed to be with a more common doctor who was more aware of CDH, which that's in my case what happened during my pregnancy.
For me, with Reagan, we found out at 26 weeks. It was between 26 and 27 weeks that we found out. And that was one thing that I was a bit infuriated about with the healthcare system. We had a 20-week ultrasound, the anatomy scan. And they had told us at the 20-week ultrasound that we needed to come back 2 weeks later because they needed to check some things because they couldn't see everything. And my husband and I weren't too concerned about it because with our first child, they did the same thing. They said they thought he might have clubbed feet and they needed to verify that. And then it turns out he didn't. It was just the way he was situated. So like the fact that they said that they just couldn't see everything and then we need to come back, it wasn't a concern for us. So we went back at the 22-week mark and it wound up being January and we had like switched insurances. And so the insurance that we were now on wasn't accepted at the place that we had been being seen. But they told us that we needed to get some things looked at. So like, my question to you is it life or death stuff? Like, is it something that we need to look at today? Because I'm willing to pay out of pocket if you need to do the ultrasound today. And the lady at the desk was just kind of like, oh, well, it's kind of up to you. I don't know. I can't tell you. I don't know what's an emergency for you and things like that. And I'm like, is there something that you have to find out about my child? Like, so basically they sent me home from that appointment. They didn't even do it. And so then we had another appointment. I had 24 weeks once we got the insurance stuff figured out and they could fit us into their schedule. You could tell that the ultrasound tech was talking to the radiologist and was like, something doesn't look right. But again, didn't say anything directly to us. So it wasn't until 26 weeks, 6 weeks after they initially saw something, that we actually found out that there was a concern and that it was a life-threatening concern. So it was just super frustrating, like the back and forth that went, and that we kind of lost 6 weeks of potentially finding a specialist and getting our baby to the right healthcare system. That was frustrating.
It was the same situation for me. At 20 weeks, they did the anatomy scan and they said that all of her organs were growing perfectly and it seemed fine and there might have been club footing on her left foot. And so me, who knows absolutely nothing, not a doctor, I'm just thinking, oh, well, if she has a club foot, like, we'll still love her. Like, that doesn't matter,
Yeah.
right? And so I talked with the doctor. The doctor was like, well, we can do a rescan just to, see and make, confirm. But then I asked her, I was like, are her organs developing properly? Is it something that I should be worried about? And she was like, no, I'm looking at the charts and it's showing that everything's fine. So you can either do the rescan or don't, because of course, we can't afford like $400, $500 just to do a rescan anyways. And so I'm thinking,
Mm-hmm.
oh, great. And so in retrospect, cut to us, giving birth to her. And we asked the doctor that's at Cook's Children, and that doctor was like, yeah, she had some kind of genetic disorder. And, typically if there's club footing, then that means that there's more going on the inside. And I wish that the doctor knew that. Like, why couldn't the doctor just
Mm-hmm.
tell me, typically when there's a club foot, then there could be more going on. So I would suggest the rescan kind of thing. That's what I wish I would have heard. But, it's just wishful
Right.
thinking because we had no idea until she was born.
I found out at 18 weeks. Um, and I was being monitored closely because I had my daughter early. So they were watching me very closely. So I went in 18 weeks and they did the ultrasound, told us we were having a boy. But then the ultrasound tech was like, can you guys just wait here? I need you to meet with the doctor. I'm like, this isn't good. I just had a feeling. So the doctor came in and was like, well, your baby has CDH, left-sided. The earlier you discover it, usually indicates the more severe. His heart's pushed all the way to the right. And I'm just like speechless. I'm like, what does this mean? What does that stand for? I mean, what do we do? And the doctor was like, well, one thing's for sure, you can't have him here. You're gonna have to go somewhere else, unfortunately. But we're gonna get you in to see the MFM. So they actually rushed things pretty quickly for me. Nobody like scared me and said he was going to pass away or anything like that. They were like, we just need more information. And so I think at 21 weeks, I got into the MFM, and he was super helpful and nice. And we did the amniocentesis because it was suggested that there could be other anomalies. And yeah, that's how my journey started. It was a roller coaster because we ended up going to Texas, and then that was a bad situation. And then we ended up in Florida ultimately. So for Goldie, hers was just a fluke. There was no genetic ties to it. It was one of the things that just happened, and they have no reason, obviously, why, because they don't know that much into it. But her condition was not genetic whatsoever.
Reagan's was not genetic, from what they could tell. And actually, she didn't have CDH, they said. So she did not have a hole in the diaphragm. She had a flaccid diaphragm that caused her organs to go into the lung cavity. So it presented as CDH. But we delivered with Dr. K's in Florida. He said he's worked with eventrations and he's worked with CDH. And he said he's never seen anything like what Reagan had. And it wasn't until like basically the day before we gave birth that Dr. K said, I don't think she has CDH. I don't know what she has. I'm still willing to keep her as a patient, obviously, and do what I can. But in the end, we weren't working with CDH, and there was no genetic anomaly to give any additional clues as to what she might have had.
Mavericks was a genetic situation. The amniocentesis came back normal with preliminary results. So that kind of sucked because they called me and was like, "Oh, everything's normal. Sweet, win." Well, then like 2 weeks later, they called us again with the microarray results, and we're like, "Well, he has 8p23.1 deletion syndrome, which is the cause of his CDH, his heart defects, his inguinal hernias. Basically every single thing the poor guy has wrong is explained with his genetics.
So with my daughter, there was not a genetic condition. They tested her chromosomes. It all came back normal. They did the full gene panel. Um, I met with a genetic counselor, and so they did that full gene panel and all that. All of that came back normal too. And so her initial thought was something called Fringe syndrome. I don't know if you guys ever heard of that, but she was like, but typically that's related to a mutation in what's called the pigeon gene, which is PIGN gene, and she didn't have a mutation in that either. So she ruled it as Bacterial association, but ultimately she had no idea what happened with her either. What kind of surgeries did your babies have to get?
So Maverick was, like I said, he was deemed extremely severe. It was actually really scary. So he had to be put on ECMO right away, is what we were told. So he was put on ECMO at 12 minutes of life, which is technically kind of considered, I mean, they put him under to do that. So it's kind of considered a surgery, I guess. I don't know. But so that was initial, was ECMO. And then he had his CDH repair at like 12 hours old. And then after that, of course, he got decannulated from ECMO 21 days later. He was able to come off. So he had to go in the OR for that. Then before we got discharged from the hospital, we had to fix his inguinal hernias because his intestines were sticking through kind of bad, and he wasn't eating very well. So they were thinking maybe that could have something to do with it.
So we went through that repair. We got discharged from the hospital for his CDH, but we knew he was going to have open heart surgery. He just needed to gain more weight because he was only, I want to say he was only like 5.5, well, maybe a little over 6 pounds when he got discharged, and cardiology would not touch him until he was bigger. But because of his heart defects, he went into heart failure. So we got life flighted back to his hospital in Florida, had his heart catheterization, and then we did open heart surgery. And then he got his eyes, he had surgery on his eyes as well, because with his genetic deletion, you can get something called strabismus, which is crossed eyes. So he had that. And that's all the surgeries he's had so far. He does have an umbilical hernia that will probably need addressed, but they said hopefully not till he's like 5. And then his heart is being watched very closely. We go every 4 months to the cardiologist for an echo, because from heart failure, the right side of his heart got extremely dilated. And so we're keeping an eye on that. And then he still has like a residual ASD that they weren't able to close all the way. So keeping an eye on that, and his valve, because valves are super touchy to fix in a baby. So if he does need open heart surgery, they said it would be like 10 to 15 years down the line, but fingers crossed that we don't have to cross that bridge. But cut to now, all the stuff he's been through, he's doing really, really well. He does sign language, he's walking, he's yelling, screaming, babbling. He eats so good, that's like the thing I'm most proud of, because he somehow made it out of the hospital without a G-tube. And that's pretty impressive for a heart baby and a CDH baby. So I'm super proud of that.
That like heals my heart for some reason. I just like, I'm so happy to hear that. The good outcomes that come out of this, you know.
He is a
best,
trooper.
I have seen so many babies have CDH that have issues eating. So that's amazing in itself that he can eat.
Yeah, it's amazing. Yeah. I mean, the bottle was not easy. I will say that journey was rough. I was like a psycho mom, counting every milliliter at all times.
It's gotta be perfect. Yeah.
Yes. But now that he's eating real food, I can breathe a little bit.
Yeah.
When she was born, she went to the NICU, and then all of a sudden she had issues breathing. She was on the ventilator, but she was incubated and everything, but they weren't sure exactly what was going on. So she was put on ECMO after 24 hours after birth, and then she was taken up to the PICU, where then she had her hernia surgery 2 days after she was born. They actually did it in the PICU room where she was at. And then she did have the Gore-Tex patch. Her hernia size was big enough that she did need the patch. And after that, she was on ECMO for the rest of the time. It was a 50-50 doctors. Some doctors said that she had a heart condition, some didn't. They said they actually fought about it every day because they disagreed, and some didn't agree, but they thought that she had coarctation of aorta. So they weren't 100% sure, but they wouldn't do anything until she came off ECMO. But in between those, she had different respiratory procedures like a bronchoscopy, things like that. But they weren't able to do anything else until she got off that ECMO, which ultimately she wasn't able to because she did end up getting sepsis. But she did have 3 ECMO circuit changes in the 18 days of her life, though. It did keep getting clogged, and they did have to keep changing them. Twice was just from the cannulas down, then the last one was actually at the very top of the cannula where it was the most difficult to change. They had to do it very quickly because it was right at the very where it was inserted. So they had to clip it at the top and put a new cannula on at the top.
With Reagan, she was born via C-section. It was a scheduled C-section. Because of the arthrosclerosis, they were just worried about her limbs not fitting through the vaginal canal. So we had a scheduled C-section. She went on ECMO at about 30 minutes of life, and we were very prepared that that was most likely the route she was going to have to go. And then she received her first surgery attempt. The surgeon opened her up and looked at her diaphragm and the placement of her rib cage. And I guess, like I said, her anatomy inside was just very unique. And she was bleeding profusely. That he said the best thing he could do was abort the surgery and close her up. She needed 13 blood transfusions. Kept her alive. By the grace of God. They basically told us that it was very tricky, and they weren't even sure if they would be able to attempt surgery again. Like, the surgeon needed to think things through. So basically, we were told that her situation was very dire, and we were able to make plans to just make memories with her for the following days and everything, and read to her, hold her hand, give her kisses. My husband and I always, one of us would sleep at the hospital with her, and the other of us would go home to our then 2-year-old. But we were constantly, I don't think my husband and I were ever at home at the same time. We were at the hospital sometimes together as we were passing off like time with Reagan. But for the most part, like, we didn't leave her alone at all. It was like either me or him was there. She was able to have a second surgery attempt. And I'm so grateful to the team in Florida and that we chose to go with them. Her condition was so severe that it was highly likely, if I had delivered with any other team, that they would have just handed her to me in the delivery room. They wouldn't even have offered ECMO as an option. And so, number one, the fact that they offered ECMO was a blessing. But the fact that they were willing to attempt a second surgery after knowing that they had to abort the first surgery, Dr. Kays was the only doctor in the entire world that would have done that. I'm just so grateful to him and the team out there in Florida. I feel like the way that they run healthcare, I felt immediately as soon as we transferred care to them that it was compassion and empathy, and that they have a life affirming healthcare team there. And that's their goal, is to help babies overcome this. I felt like the team that we initially had already given up on my daughter, and they weren't going to put all life-saving options on the table. So they gave her the second surgery, and it wound up being successful. And they were able to make a makeshift diaphragm for her. They were able to pull her organs down and give her lungs room to breathe. After 14 days, they just had to let us know that they had seen what her lungs looked like, and they didn't look like normal lungs. And so they just had to assume that for some reason there were holes in the lungs or something like that. And the lungs just, for whatever reason, couldn't hold air. And so it was at that point that she was deemed incompatible with life. We were given the option. We were asked if there was anything that specifically that we wanted to do with her. I was able to hold her skin to skin. It was her last day of life. And there were like 3 nurses that helped her from the ECMO bed onto my chest. And it was so beautiful. Like, I feel like I felt at peace. Her heartbeat, her heart rate was stable. And all of her stats were very stable while she was on me. And it was just such a peaceful moment and a beautiful thing that we were able to share. We knew it was the final days. She was there and she was perfect and she was functioning because of the ECMO machine. Um, but she had been on the ECMO machine for 30 days and they start running into issues. So it was highly likely that eventually it would get a clot or she would get sepsis or, various things. But
I totally understand your feelings. Seeing your daughter on the ECMO machine, and realizing that's the only thing that's keeping her alive. They had her on ECMO and seen her on all the tubes. When we came into the room, she was by herself, and she was, attached to all the tubes. And I think in that moment, I blame myself. I think just the idea of her being alone for even X amount of time, they wouldn't let me go with her because I had COVID at the time. And so, in fact, they didn't even want to let me go from the hospital because I had just given birth to her. It was like 4 hours later. My blood pressure was 236 over 206. I remember clearly. And I told them, I'm leaving. Like, I'm going to go see her. And so, my doctor okayed it. And I'm so thankful too, for the team at Cooks. They did what they could and they let my family, with no restrictions, anybody could go see her. All of my family was there within 30 minutes. So they got to see her, they got to touch her, they got to sing to her if they wanted to, do whatever. We got 6 hours with her, just all of us. And so um, like you said, it was really beautiful. It was very beautiful. It was very bittersweet. You know, I carry a little bit of regret. I didn't have the capacity or the space to see her pass away peacefully. So I said goodbye to her um, while she was still attached to the tubes. I didn't want to see her pass away. I knew my heart couldn't handle that. I had already just given birth to her. I just found out something was that she was gonna pass away. I had no idea. And so I could not take it. I knew that if I saw her, we would be in I don't know if I would be here today, honestly. So by the grace of God, for real, my husband's parents stayed with her. Um they were like, we'll take that off of you. Like, you don't have to do that. We know she knows that you love her and she knows that you did whatever you could to be with her. And I remember when I called my family, I remember I had so much guilt. Just making the decision to let her pass away peacefully. I felt like I was giving up on her too soon. But I remember my aunt told me that's the most mommy thing you can do for her is to let her pass peacefully with her family. And it was it's hard. It's hard for any of us. And just hearing your stories with watching your babies going through these surgeries, not even knowing the outcome of it, that that alone is so hard. But at the same time, what you're advocating for your children and you're doing it because you love them so much. And that's also the most mommy thing you guys can do too.
Even being home now in Maverick's care now is still, doctors here just don't understand. I have to tell people still, like medical professionals, what CDH is. It's super sad.
They saw that she was only breathing on one side. So that's how they found out. So they quickly rushed her to Cook's. But again, all of that time, there was no intervention, none. I think we deal with a lot of guilt. Um, should we have done that rescan? If we did, would there have been more intervention? Would we have been able to go to those specialists to get those surgeries done? Could she have had a sustaining life. I don't know, and so me and Matt deal with a lot of guilt to this day.
No matter at what point in your journey, I think that we're all going to have questions of what caused the CDH, or, like you said, if we had chose another specialist, would the care that they provided have been the one that was the right type of care that our baby needed? The unfortunate thing, I think, is we'll never know the answer to those questions. And I don't know if any of you have found something like that, where like you just decide to blame something because you can never prove if that was the actual cause or not, but it kind of just gives you a sense of peace to blame something.
No, I definitely, I can't speak for everyone, but obviously I think we all here share the same, the guilty of, was it this that I did? Did I eat this? Did I exercise too much? Was I doing something I shouldn't be doing? And
Yeah.
the cause of it is no one will ever know. Doctors don't even know. And it's that part is really sad to me, because we as mothers already lost our child, or having Stephanie's now she's living with a child who has to care for her son the rest of her life, and doesn't even have a doctor who even knows anything about it. So she has to do all these things herself, when it's the doctor's job to take care of her child. And that was, in our situations, the doctor's jobs to take care of our child, because we aren't medical professionals by any means whatsoever. So we can't do what we know to do for our child without their assistance. And that's where our guilt comes in, because we think of all these factors of, well, I should have done this. Should I spoke up sooner? Should I just said no? Should I not have let them do that? And should I intervene? I mean, there's so many shoulds or could haves, but ultimately it's not our fault at all. Nothing is our fault. We did as much as we could as parents, and we did what was right at the time of what we thought was right. And our kids, our babies are grateful for that. I mean, they had the love that they needed. We sung to them, held them, whatever we needed to do. They knew they were loved, and we could do everything possible for them at what we had to work with. I mean, I know personally I did as much as I could. I fought to the very end. I did the best that I could. I gave all my effort. And there was just so much only I could do as just a parent. I'm, like I said, I'm not a medical professional, so I can't do those things for her. I could only be her advocate and do what I thought was best. And as Stephanie, she has to do now for the rest of her life. She's going to have to advocate, because there's no one else to do it. There's not enough information. There's not enough to go on. There's just nothing for CDH in itself, along with other conditions or abnormalities that come from the condition, whether or not they're tied together. They still don't know any of those things, and it's just makes it harder for people who are surviving with CDH, and people who have lost their child. I think it just makes it more difficult.
Yeah. I mean, Maverick is my second NICU baby, so my guilt stemmed from, prior to even Maverick, and then this was just like the icing on the cake of, what did I do? Like, why do I keep getting NICU babies? I don't understand. So it's still a grieving process for me, because I still haven't experienced holding your newborn baby. Like, it's different kind of guilt, but I feel it too. So
With babies who have, the genetic anomalies, and not knowing that, like, what even caused that, like, that alone puts so much weight on us, even to this day. We know that there's nothing we did, it's nothing that we did that caused that, but at the same time, you just wish that doctors had more research on it. It's kind of what I'm getting at. So if you could say anything to the healthcare system, what would you say to them?
For me, I have ran across so many doctors that are not sympathetic or empathetic, like they don't show you compassion. It's just you're a number to them. I think that is the most hurtful thing for me, and that's why I'm so thankful to Dr. K's and the doctors in Florida. Is never once did I feel like a number or like they didn't believe in my son. When we see that all the time, like even the doctors here are like, I mean, they just, no one knows what to say or how to treat it, I guess. And it comes across as they're being cold, because I think doctors can be kind of egotistical sometimes. Like, nope, they know everything, and that's no other doctor can say anything else. And you, especially as someone who's not a medical professional, can't say what you know because they think they know better. I just wish they would educate themselves more and learn to be more compassionate.
I definitely can agree with that. On top of being honest, I think there was, I don't know how many times when we were in the hospital and they were doing rounds, and they would, I mean, I would sit in and listen to the rounds. Granted, I might not know everything they were saying, but it was helpful for me to know. I mean, I want to know it all. I want to know the good. I want to know the bad. I want to know all the information possible. And they would withhold information from me. They wouldn't tell me the truth. They wouldn't tell me certain things that they wanted to do, what was going on, or what they had planned for the day. Um, I think the truth goes a long way, especially in a situation like that. We don't know the ins and outs of terms or things like that. It has to be to the level of what I know. And those things can be explained at my level. And they didn't do it until I spoke up. And I think that's super sad because we need to know what's going on. Whether or not we understand is a different concept, but make it a concept that we understand. Um, and I think I wanted a straight up answer. I said, "So what's her percentage of living?" And no one would ever give me a number. And that was really heartbreaking to me because I just wanted to know. So if I were to say anything to the healthcare system, be honest. Um, Truth goes a long way. In advocating, letting parents advocate for their child. If I say no, I mean no. I shouldn't have to say it more than once. I said no, I don't want that done. I don't want that procedure done. For an instance, she was poked and prodded literally all day long, all day and all night. She needed a day just to rest. I mean, she was a brand new newborn baby. In my opinion, she needed a day just just to rest. And I was able to advocate that for her, and they gave her a day. And just the amazing outcome she had just for the day of rest was absolutely amazing. Um, so listening to your patients, a baby can't talk. So listening to the mother, father, or guardian, or whoever is in the room, listening to what they have to say in the truth, always speaking the truth is what I would have to say.
The main thing that I would communicate to any healthcare professional, if I had the ability, is number one, no matter if they're diagnosing you at 10 weeks, like I know some people have been diagnosed at 10 weeks, or you're diagnosing them at the 20-week ultrasound, or if it's after birth, no matter when the diagnosis comes, like, you are talking about our child. You're not talking about an anomaly. You're not talking about some abstract thing that could potentially just go away. You're talking about our child and you are giving us a diagnosis of our child. And so what we need at that point is empathy, compassion, and an action plan. What are we going to do? How are you going to treat our child? How are we going to overcome this diagnosis, basically? What is the treatment going to be? And with CDH, a lot of times, if diagnosed in utero, you can come up with an action plan, and while life threatening, it can be treatable if you put the right actions together. But with even more severe diagnoses, even if the only thing you can offer a mother is the opportunity to hold her baby for a few minutes and let them slip away peacefully, like just being able to create an action plan of any sort um, is what we need when we have to face the possibility of living in a world without our child. So that's like one of the main things I would want to tell the healthcare system is just, know that you're always talking about a person, and always know that you're talking to a mother or a father. You're talking to people who love this child already. And we want to know that you're on our side and that you're going to provide a safe environment for them no matter how long they're on this earth, and that if it is a treatable condition, that we put action plans together in order to treat it in a timely manner. And also, I would want them to admit what they don't know. And one of the most disheartening things for me is I was sent home from our diagnosis day in complete despair, basically told that I was with the best team for CDH there was. I wound up finding out about Dr. K's and John Hopkins All Children's Hospital in Florida, and finding out that, in fact, he had much more experience with CDH than my team. And so I didn't know all the ins and outs of relocation. So I actually wound up calling my team and saying, hey, I want to see about getting a second consultation with Dr. K's. Can you guys refer me? And it was so frustrating because, number one, they knew about Dr. K's. They knew about his reputation, and they knew that he was better suited to deal with right-sided CDH than their surgeon here. But they were not willing to refer us because they didn't want to lose us as a patient. And so that's just frustrating that, again, you're seen as a number or a certain amount of income. I don't know what they were looking at, but that even knowing that there was a better surgeon out there, they weren't willing to get our daughter there. I had to do all the work and advocate for her. If the healthcare system was able to be more compassionate and actually be in the business of saving lives and not earning money, would be fantastic.
What I would say to any healthcare medical professional that might come across this video, be more knowledgeable about the fact that these things can happen. Um, don't go into it thinking, oh, these patients will never have something like that happen to them. I think in my case, it just feels like I was just another healthy pregnancy to them, and they didn't know that, a club foot could be more. And I wish that I would have heard, that could be a sign that there's underlying conditions that could be happening. So just understanding that anything can happen, and to definitely address those concerns that that mother has and acknowledge them, and don't tell them, oh, it's fine, they'll be fine. If they ask for another ultrasound, give it to them, just for peace of mind, just to support them in their feelings and their emotions. And don't wait for a loss to happen to give them the medical experience that they need.
I say I've made some of, honestly, my best friendships because of this journey. And it's nice to feel, I mean, because you can have supportive people, and that's great. A support system is also very, very important. But the facts are is people just don't know what to say or how to treat you sometimes. And so it really, really helps to have somebody who's in that exact situation, or definitely make friends. Don't be afraid to reach out if you know there's another CDH family there. Like, reach out, see what happens, because I've made some of my best friendships because of this journey. So
I agree. I mean, CDH is, I mean, no one understands it more than we do, whether loss or not, or surviving child or living. We all have endured CDH somehow, one way or another. And I think someone who's coming into this, I know it, I was afraid to reach out at the time to anyone else. So to someone else who is starting their journey, don't be afraid to reach out, whether that be to someone who has a living child or someone who has lost a child. You can learn so much from both perspectives, and get the understanding of what to look for, what not to look for in both of those ways. I know I have things that I could help others with, and in the aspect of fighting for their child, or trying to get that second opinion, like I said. So it can be really helpful to get the knowledge from someone who has endured both sides of the CDH world. And unfortunately, it does suck that this is how we all have come together, but I don't think that uh, this has put me in a new place, to say the least. This group of people that I have met and who I am meeting along the way is something super special. Um, and it almost makes me feel like Goldie had a purpose for.
So we did start a nonprofit organization in Reagan's name. It's called the Reagan Valeria Foundation, and our specific purpose is to help any NICU baby, but specifically diagnosed in utero with a medical complex condition. We want to help them get to specialized health care. So we offer a relocation grant for families that have already decided to relocate to a specialized healthcare unit. We also are open to helping families seek out that specialized healthcare. So if they come to us and present us with the diagnosis that they have, we know where you can seek out that information and basically try to find where the best support would be for your child, no matter what their diagnosis is. Like I said, we have a relocation grant specifically for that. And then we have a rehospitalization grant for babies that have come out of the NICU but go back into the hospital for any reason. And then we have a bereaved parents grant as well for parents that are facing the loss of a child. And that is, specifically to help pay for funeral costs or medical costs that they've incurred. You can just find more information at the ReaganValeriaFoundation.com. We work mostly with CDH babies because that's the community we're mostly associated with, but we are open to helping any child diagnosed in utero or who has a life-threatening condition upon birth. If relocation is a possibility for you, like meaning you find out in utero, you have time to plan. I just would definitely always suggest getting a second opinion from multiple hospitals if you have the time, but reach out to Dr. K's in Florida. It's just the compassion and care that they offer, I feel like, is top notch. And their expertise in CDH and dealing with having dealt with so many children with CDH, so they also know various complexities that can arise from different situations and how to deal with them.
I consulted with 3 hospitals total. Florida was my final one, Johns Hopkins All Children's Hospital in St. Petersburg, Florida. And as soon as I met that team there, I knew that was where we needed to be. I can't say enough good things.
Whether you have a living child or you've lost a child, CDH had a purpose, and it's bringing all of us new people together to advocate for our children now and to bring awareness to CDH. And it's our turn to get that information out there so more medical professionals can start becoming aware of CDH, so we don't ever have to endure the pain and loss or endure the lifelong effects of CDH, and we can try and prevent or find a solution to maybe CDH altogether.
When the doctors say that our children were incompatible with life, to me, I think they're the strongest ones out there. They, they say that they should have made it past the first trimester, yet they made it outside of the womb for X amount of time. And I think that's incredible. So I would say that we have some of the strongest children out